Hi, this is Dr. Gollum, and today we have a video lecture on payment basics, which is our Module 1 in the Coding and Billing and Dietetics course. This module is divided into three main sections with the topics listed here. We first have health insurance and other funding sources, first steps to becoming a provider, and referrals and primary care partnership. And so in this first video, we will just go over the Section 1, health insurance and other funding sources. There are two main parts to health insurance and other funding sources. We have A, which is basic information about health insurance, and then B, sources of revenue and funding beyond insurance, and we will talk about both of these today. When talking about basic information of health insurance, we're really talking about how do people obtain health insurance and where they get it from. What are the differences between benefits and coverage, and what does that really mean, and how does it connect to payments for MNT? Understanding coverage for MNT, and we'll talk about dual coverage and benefits for preventive services under the Affordable Care Act. We'll also talk about, with the basic information, government health insurance benefits for MNT. So with government health insurance, including Medicare, Medicaid, the Children's Health Insurance Plan, and then the early and periodic screening, diagnostic, and treatment benefit. We will talk about all of these in this section. I get a lot of the information from the links that I provide you in your notes from the eatright.org pages, and this is where I pulled some information from the Kaiser Family Foundation. In 2018, they published a study that revealed that about half of Americans got their insurance through their employers. So basically, employers purchase a huge group insurance, and employees will chip in for it. And so part of their, like a small part of their paycheck will go to their own health insurance, while the employer pays the rest. So that's about half of Americans. 20% of Americans had Medicaid in 2018, and Medicaid is a government health insurance program for people with low incomes. 14% of Americans had Medicare, which is a different health insurance program from the government that's designed for people that are aged 65 and older, or for people with specific disabilities. And then 6% purchase private insurance on their own as individuals, and so they paid out of pocket for it. And so that left about 9 to 10% of Americans and who don't have any insurance in 2018. And this number has stayed around this percent, even though it has been growing in the past few years. It's still around 9 to 10% of Americans do not have health insurance that provides coverage for their health care. So that is something to consider when you go out and work in the field and come across individuals who may actually qualify for Medicaid or Medicare. But we will get into each one of these types of insurance. This is just to kind of let you know where Americans get their health insurance. Now, when looking at how to obtain health insurance, it's very useful to be able to divide the different types of insurance. And so basically, we have two main types. We have private commercial insurance companies, and then we have government health insurance programs. The private or commercial insurance, they're for profit, and they are funded by monthly premiums, which is basically the monthly charge that they give to all of their clients. They have individual policies for all the people who come to purchase from them. Now, they also provide those employer-provided groups. So if an employer, such as New Mexico State University, provides these options and benefits to their employees, they basically bought a group plan. And so they have group health insurance policies that the employees can choose from. Now, this varies by state, since states have different regulations governing insurance company requirements. And so everything's going to be a little different from state to state. Now, the other half is government health insurance programs, and these are reserved for specific subpopulations within our population. So for seniors, for low income, for veterans, etc. Some examples of government health insurance programs include Indian Health Service, Medicare, Medicaid, the State Children's Health Insurance Program, TRICARE, the Veterans Health Administration Program, and so on. Now, these programs are funded mostly through taxes, and they're designed to provide medical coverage without gaining a profit for themselves. So unlike the commercial insurance companies, these government health insurance programs don't turn a profit. Here are a few things that you should know about commercial health insurance. They provide individual policies, and basically you select a plan based on a few of these considerations, including the services that are covered, the monthly premium, and the annual deductible. Now, the monthly premium is the monthly payment that the covered person or you have to make in order to have that policy. The annual deductible is the money that an individual must pay before insurance coverage kicks in. And in the notes section, you'll see a much longer definition that was provided on the Eat Right website. And it just indicates when you read this, you'll recognize there are all these different caveats and details that you need to know when you're a healthcare provider and you're charging health insurance. But for now, all you really need to know is that there's these three main things to consider when picking a policy that's right for you. Now, the services covered, they vary with each policy. And generally, the health insurance company pays a significant portion of medical expenses, while the covered individual only pays a small portion. And that's kind of the whole point. However, elective procedures, which are procedures that are not medically necessary, they're typically not covered. And that includes rhinoplasty or plastic surgery or anything aesthetic in nature is not covered. Qualifying expenses and preventative services are covered, and so that's something to look into with every policy plan, is what qualifies to be covered and what preventive services, including nutrition counseling, is covered. There are a lot of different types of commercial health insurance, and I listed most of the common ones here. We have HMO, PPO, EPO. What I did was make a handout that you can refer to that gives a explanation for each one of those. In fact, we're going to go over those next. It's important to know the difference between benefits versus coverage. A benefit is the actual service or item that will be covered. Like, for example, nutrition counseling. Now, the coverage, when that term or coverage determination or allowable coverage, those terms really are referring to all the details surrounding the ability for the individual to access a particular benefit. So they outline when the benefit is covered. What conditions or diagnoses does a person have to have for them to obtain nutrition counseling? How long do they obtain nutrition counseling? How many hours a year and whatnot? What determines benefits and coverage? Well, that depends. And it really depends on the policy. Some individuals may have benefits for MNT or nutrition counseling, which are limited to certain diagnoses and conditions, and other individuals may have a benefit for MNT for any condition, or for any condition if the criteria stated in the coverage details are met. And so this criteria is really what's people need to know. Knowing the coverage details are important because they really inform the conditions for payment for providers. So it's something that you'll definitely want to know, and we will talk much later about how you would learn this and reference this information. Some of the information that might be included in coverage details are the benefit for MNT, like in-network providers or out-of-network, the number of visits or hours, the specific conditions or diagnosis included or excluded, and deductible requirements, co-payments, patient share of costs, like the percentage of allowable charge that they can pay. Now, it is possible for an individual to be covered under more than one health insurance plan, and this is called often dual coverage. So having either two types of private insurance or having Medicare Part A and Part B and other private insurance. So the main thing to consider when you come across anyone with more than one health insurance plan is which one do they designate as their primary insurance policy, because that's where health providers go first. It's important to note that the Affordable Care Act did change the way that many of the benefits and services are included within health insurance plans. So they added a lot of new inclusions for coverage of specific types of preventive services, including nutrition services. And this includes healthy diet and physical activity counseling to prevent cardiovascular disease for adults with cardiovascular risk factors, and obesity screening and counseling for adults and children. And so this is really a big boon for the field of nutrition, because once government health insurance plans start including something and seeing it as the norm, then private and commercial health insurance companies start stepping up to that plate as well and start including it. So before, this is just common knowledge, before you provide service, you kind of want to look at the patient's benefits and coverage details to make sure and let them know this might be out of pocket, and everyone's on the same page as to how this is going to be paid for. Now we're going to go over the different types of government health insurance in a minute, but now we're on the topic of benefits and coverage. And so here's some examples of government health insurance benefits for medical nutrition therapy. Medicare Part B has a benefit for medical nutrition therapy in outpatient settings with patients with a diagnosis of diabetes, chronic kidney disease, and or 3 years after a kidney transplant. This benefit Part B coverage for the MNT benefit includes 3 hours of MNT during the first year a patient receives MNT, 2 hours of MNT in subsequent years, and then Medicare will pay for more hours when the patient needs more care. And so this is really dependent on several other factors, and we'll get into that later. Now, Medicare beneficiaries with end-stage renal disease can receive MNT as part of a comprehensive dialysis service, even though it's not through their Medicare Part B. Now, the other examples in Medicaid, MNT and nutrition counseling is not a required benefit in Medicaid programs, but many states have elected to include it for their Medicaid enrollees. So that MNT benefit and coverage really varies based on state for the Children's Health Insurance Plan and also for the early and periodic screening, diagnostic, and treatment benefit. So it really depends, and what this all comes down to, you don't have to memorize all this, but you just have to recognize that MNT is now, we're starting to see it in different places, but we have to go and reference the actual plans and policies to find out what and how much is covered and in what conditions. Here is the handout that I provided you, developed the most common types of government health insurance programs, and this is going to be a great reference for you, not only for the class but afterward. I also provided some links to the sources of this information and where you can learn even more. So we have Medicare, which is a federal health insurance program provided by the government, so it's national, provided to people aged 65 and older, certain people with disabilities, and people with end-stage renal disease. Medicare beneficiaries pay premiums for Medicare plans, so they do pay for it monthly. Medicare Part A covers medical care in a hospital. Medicare Part B, which you'll hear a lot of, covers outpatient services, which includes a lot of the MNT services that are covered by Medicare. Part C is that Medicare Advantage, and again, we'll talk more about this later and in more detail. And then Part D covers prescription drugs. So this is just to give you this conceptual understanding when people are like, oh, Medicare Part C, and you're like, what does that mean? This puts it in perspective. Now, Medicaid is health coverage that's administered by the states according to the federal requirements. So it is a state-by-state program, but these programs have to meet federal requirements. It's health coverage that's provided to eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. And so you can go to this link to find more information about Medicaid and what eligibility really means. What does low income mean to Medicaid programs? Children's Health Insurance Plan is an insurance program that provides low-cost health coverage, and it provides to children in families that earn too much to qualify for Medicaid, but they don't earn enough to actually purchase private insurance out of pocket. In some states, pregnant women are eligible for CHIP, is the acronym, CHIP coverage. Now, each state offers CHIP coverage and works closely with its state Medicaid program. And again, here's a link to learn more. And the early and periodic screening, diagnostic, and treatment benefit. And this is a benefit that provides really comprehensive and preventive healthcare services to children under the age of 21 who are enrolled in Medicaid. And so it kind of pads it on to Medicaid recipients that are under the age of 21. All right. Now, moving on to sources of revenue and funding beyond health insurance is really covered in this slide. We have 5 major sources of revenue: foundations, local, state, and federal government grants, employer programs, membership and concierge healthcare services, and self-pay. Now, foundations, a foundation's really any entity that supports charitable activities. And there are large national foundations or smaller local foundations that could support nutrition-related initiatives, educational programs, and pilot projects. Now, these funds could support the work of nutrition professionals. Government grants often fund health initiatives and programs that utilize nutrition services. Employers may invest in strategies to improve employee health and well-being and to reduce growing healthcare costs. So corporate wellness programs, you probably heard that corporate wellness phrase before. These programs are an example of sources of revenue and funding for health beyond health insurance. There are community and private clubs that may be interested in incorporating nutrition programs and services into their membership benefits. You can kind of think of the clubs or gyms or whatnot. The membership fees would be expanded to fund these services. Now, concierge medical services, it's like, when medical services come to you. These services actually provide opportunities for dietitians to partner with practices where payment for MNT services could be from health insurance payments that are factored into the concierge services monthly fees. And so, in other words, the monthly fee would state, well, we also have these MNT services. And then finally, self-pay. This is another way to say out of pocket. Some clients are willing to reach into their own pockets to pay for nutrition services. Now, one thing to consider with this is that when things get tight, often the excess spending stops, and they would easily shift nutrition counseling just like you would shift getting massages into, I can't afford that anymore, so I have to move on. But self-pay is one source of revenue beyond health insurance. Okay. So that pretty much covers the first section of a Module 1 Payment Basics. Next video will cover the first steps to becoming a provider.